Surgery on shoulders for rotator cuff disease, whether it's torn or just inflamed, are very common, probably one of the most common surgeries that I do. These are outpatient surgeries. They can cause a fair amount of pain, but fortunately we have very good methods to take care of that. Our anesthesiologist can do blocks to help minimize the pain afterwards. The block does tend to wear off in the middle of the night, so we like you to take some pain medication before you go to bed so that you don't wake up behind the 8-ball at 2 in the morning. Anti-inflammatories are also very good at helping control this pain afterwards. The surgery is an arthroscopic surgery. We go in, we clean up all the inflamed tissue, the bone spurs that can be digging into the rotator cuff. Sometimes the biceps is inflamed and we have to address that, as well as some arthritis at the end of the collarbone at the AC joint, which we occasionally will shave out. And then we address the rotator cuff. If it's just a little bit irritated or frayed, we can clean up those frayed edges, but when it's torn, it requires repair. We do this, again, arthroscopically. We're able to put in anchors. They're almost like sheetrock screws that have suture attached to them, and then we're able to weave that suture through the rotator cuff and use that to tie the rotator cuff down. With the repair, you're in a sling, usually about 6 weeks. It depends a little bit on the size of the tear. You have passive motion initially. If you start to move your arm right away, you can rip those sutures through the rotator cuff. So we have you use your other arm to lift it and then pull it down against the resistance of that hand to keep the stress off of the rotator cuff while it heals for 6 weeks. We have you focus a lot on your posture, keeping your shoulders back in good position to help take some of the stress off the rotator cuff. After you come back and see us after a week and a half or 2 weeks, we start you in therapy, and it's usually about a 3-month recovery.